Good morning, everybody. Welcome to the May Walk with the Doc. So the topic today is called Congestive Heart Failure Meets the Space Age. Enters the space age. So why the space age? Well, last time we did a Walk with the Doc, a couple of our folks here were talking about Star Trek and how much they like it. So I thought I'd incorporate some Star Trek references into our talk today. Do you remember the original Star Trek series from the 1960s? Remember the Doctor, Bones McCoy? So whenever a member on the Starship Enterprise got sick, they'd go to the doctor, he'd wave his tricorder, his medical tricorder, a device, just wave it over them, get a diagnosis, sometimes be able to treat them. So it was a good device. You know, there was no pain to the patient, there was no radiation, nothing like that, no risks to the patient. So the topic today is, are we any closer to doing something like that in our own world? Let's see. So I'm going to talk about it in the context of shortness of breath. Shortness of breath is a very common complaint, one of the most common complaints that people present to the emergency room with. And congestive heart failure, fluid in the lungs, is a serious problem and one of the main causes of shortness of breath from the heart standpoint. So we always try to look for it if somebody's coming to the ER complaining of shortness of breath. So as I said, CHF is very common, carries a very high morbidity and mortality. There's over 60 million people worldwide that are affected by congestive heart failure. In people over the age of 55, there are 1 million new cases of CHF diagnosed each year. It's huge. In 2016, 10 years ago, there were 1.9 million doctor visits due to CHF, and that's only increased over the past 10 years. And there's been more than 400,000 emergency room visits for congestive heart failure as well. It's the most CHF is the most common reason for people to get hospitalized in the U.S. So you can imagine it's huge. After a hospital admission for congestive heart failure, 83% of patients will be back for a second admission, third admission. So it's very tough to keep people out of the hospital. There's recurrent admissions, recurrent problems. And considering all the doctor visits, emergency room evaluations, hospital admissions, readmissions, there's a huge economic toll of CHF in the country. More Medicare dollars are spent on CHF than any other diagnosis. In 2020, $32 billion were spent on CHF. Also, congestive heart failure has a very high mortality. After someone develops congestive heart failure, prognosis isn't as good. 42% of people will die within 5 years after a diagnosis of CHF. That's as bad as some of the bad cancers that are out there. Now on the bottom we have the prevalence of congestive heart failure by age and sex. And as you can see, as we hit our 60s and 80s, men and women, the diagnosis or the prevalence of CHF goes up dramatically. On the next page, I gave you a graph of the prevalence of congestive heart failure, starting in 2012 and projecting out to the future for various groups. And as you can see, the prevalence just keeps going up and up. Let's get back to our shortness of breath. When somebody presents with congestive heart failure to the emergency room, we'll do a few things. We'll take a listen to them, listen to their heart and lungs, get a chest x-ray, get some labs, and a lot of times we can figure out if they're in congestive heart failure based on that basic examination. But a lot of times we can't make the diagnosis. This is tough for some reason or another. Wouldn't it be great if we could get a medical tricorder to bring to the bedside and try to get us a diagnosis and help us with all of this? Well, there is such a device out there already. It's being used in the emergency room already. It's called point-of-care ultrasound. And I gave you pictures of a couple of the probes for the ER's point-of-care ultrasounds. So what it is an ultrasound probe like we have here. It's attached to a wire. The wire gets hooked into a regular old laptop. The laptop's on a stand that gets moved around. They can bring the point-of-care ultrasound right to the patient's bedside. They'll take pictures of the heart, the lungs, and it's very good at distinguishing congestive heart failure from other causes of shortness of breath. That's what we're trying to do when we're in the emergency room. of care ultrasound can tell if there's fluid in the lungs, it can tell the body's overall volume status, and it can tell the heart function. So if there's a weakened heart or anything, then a diagnosis of congestive heart failure is much more likely. So these point of care ultrasounds, again, they have a wire attached to them. You put some gel on it and you put it onto the patient. So there's no IVs, there's no radiation, except for the gel and stuff. There's really no discomfort for the person. And again, it gets attached to a regular old laptop. But you can get these point of care ultrasound probes and just put it in your regular old phone and bring it around. Some people have done that. Now, if you want to do that, it costs some money. The probes are like several thousands of dollars, so it's not really available for everybody all over. What is available for everybody? Smartphones, right? Everyone's had a smartphone these days. So there's a couple of smartphone apps that may give the general public access and ability to diagnose congestive heart failure. We'll talk about two of them here. The first one detects changes in motion of the heart. So heart motion, vibrations of the heart get transmitted to the chest wall. So using just a regular old smartphone with sensors that are already present, you can put the phone on the chest wall, be laying down, you put it on the breastbone, and the app will be able to tell the difference in vibrations and being able to tell whether somebody's in congestive heart failure or not. Sounds like that might be very useful. It would be for us. Second app uses speech recognition technology. And apparently there are changes in people's voices that can determine if someone is in congestive heart failure. So just talking into the phone, into your app, can tell if there's a wet voice, that you have some extra fluid on board, or a dry voice and something else is causing congestive heart failure. Now, the apps will be important, when and if they become available, because you want to be able to detect congestive heart failure before people start having bad symptoms, before they need to go on massive medicines, before they end up in the emergency room and in the hospital and get really sick. And in fact, the voice app was able to detect CHF 20 days before hospitalization becomes necessary. So, once these things are available, it'll be quite the boon to help keep people out of the hospital and help us as doctors as well. Unfortunately, point of care ultrasound's expensive, not available for everybody, the apps aren't available. So what can you do sitting here to prevent congestive heart failure until all of this gets set? Well, there are four main modifiable risk factors for CHF: hypertension, high blood pressure, diabetes, obesity, and diet. So with high blood pressure, hypertension, each 20 millimeters, each 20 points above in systolic blood pressure will increase the risk for CHF by 28%. Lowering the blood pressure by only 10 points decreases the risk by 28%. With obesity, congestive heart failure people with normal heart function, almost 80% of them will have obesity. A body mass index greater than 30 doubles the risk for CHF. Body mass index is a calculation between the weight and height for people. And there's apps you can figure it out for yourself. So normal BMI is 18 to 25, overweight is 25 to 30, over 30 is obese. So if you're in the overweight to obese range, a 10% reduction in body fat mass reduces CHF by about 20%. Along the same lines, being sedentary increases the risk for congestive heart failure, and a high amount of physical activity decreases the risk by 23%. Diabetes isn't good for heart failure. These newer agents are a boon in helping us prevent and treat people with CHF. The GLP-1 agonists like Ozempic, Zepbound, Mounjaro reduce the risk for congestive heart failure by 18%. SGLT agents like Jardiance or Farxiga are able to decrease the risk by about 30%. And we use them when people are actively in congestive heart failure. They've been very good for us as physicians. What about diet? What can you do eating-wise to prevent congestive heart failure? So there's a very good study looking at plant-based Mediterranean-style diet, and that lowered the risk for heart failure by about 41% versus some of these other diets, and we'll talk about those in a second. A couple of other modifiable risk factors include keeping alcohol consumption low and keeping sodium or salt intake low in the diet. So that's what we'll talk about at the bottom graphs here on the page. So these are the risk factors, and far and away hypertension is the biggest one that we can affect to try to prevent congestive heart failure. Diabetes is on there, low grip strength, indoor air pollution, diet, obesity we all talked about, depression, alcohol use. What about just some concrete guidelines? So for hypertension, the risk factor target for prevention of CHF, you want blood pressure 130 and maybe a bit below. Starting to go above 140s, then you got to talk to your doctor and see what you can do to get it down. With diabetes, you want hemoglobin A1C, a measure of diabetes, you want that under 6. Cholesterol, the LDL bad cholesterol, under 100. Inactivity, being sedentary, 150 minutes per week of moderate walking. Moderate is you build up a little bit of a sweat, but you can still carry a conversation. So 150 minutes of moderate per week, or 75 minutes of vigorous. Vigorous is you work in hard, you get sweat, but you can't carry a conversation. As we said, obesity, losing 10% of the body weight and getting the BMI under 30 will be helpful. Now with alcohol, if you're not drinking, then don't start. If you're drinking more than 2 to 3 drinks per week, probably time to cut it back to about 2 to 3 per week. And that's an ongoing thing. We'll see how that goes over the next few years. Smoking, you should stop. Sodium, salt in the diet. I haven't done any talks on it because it's a complex subject and it's very controversial as well. So just from general guidelines, the maximum we'll have you do is about 2,000 to 3,000 milligrams of sodium per day, and you should be fine with all of that. So the prevention of congestive heart failure doesn't involve any space-age technology. It's good old-fashioned lifestyle modification and perseverance. So, in the future, you'll be able to get your smartphone, put it on your chest, talk into your phone, and figure out if you have heart failure, giving us a call. But until then, you got to work on these risk factors to try to prevent becoming a CHF statistic. The last thing I have for you guys on the last page is the diet stuff. This is the study that I was talking about. So plant-based diet, vegetables, fruits, beans, fish, decreases the risk for heart failure. What they call a southern diet, fried foods, organ meats, processed meats, eggs, added fats, sugar-sweetened beverages, that all increases the risk for heart failure. Some of these other diets that they have listed here didn't have any association with heart failure, but probably good to avoid some of this anyway. So hopefully this was interesting and helpful, and we'll catch you next time in June. June 13th is our next one. So have a good rest of the day. It looks like it'll be nice out there, and good questions.